Many people ask me, why should my child see a chiropractor? I definitely recommend for children seeing chiropractic right after birth, for example, because the birth process is not necessarily easy on the mom and not necessarily easy on the baby as well. So it's always great to have children checked after birth just to make sure that everything is okay. I do have a pediatric certification, and so I feel very, very comfortable and have a lot of experience working with children. So I want to share with you guys a couple of different things that I see in my practice and how chiropractic has helped children as well as their parents and families. One of the number one things that I will see is colicky babies. Colic is defined by a baby who cries for 3 hours at a time for 3 days for 3 weeks. So 3, 3, 3. That's a lot of crying. And if any of you have had a colicky baby, it is very unsettling. It's hard on the baby and it's hard on the family. A baby has absolutely no way to communicate that anything is wrong aside from crying. So colic is a sign that there's something wrong. So what chiropractors can do is we can evaluate these babies, and mind you, everything is extremely gentle and soft, and we use fingertip pressure, so very, very gentle. We can evaluate the baby and make sure and just see how their nervous system is working. A lot of times there are restrictions, usually in the head or at the base of the spine, that can cause some tension or torsion or twisting on that nervous system that is just uncomfortable for the baby, and so they're crying. Many times I've adjusted babies within a couple of days. They're doing a lot better. They go from crying for 3 hours to crying for 1 hour. So those are huge when it comes to a family. Another thing I'll see with the young children is feeding difficulties. So if a baby is breastfeeding or bottle feeding, they may have a problem with their latch. They may have a problem with indigestion or problems with their stomach as well. And what chiropractic can do is help to, again, alleviate the spinal subluxations up here. And we can also do work on the cranial bones, which affects how the baby sucks. We can look inside the mouth and just see how the palate is, and if that's unlevel or if there's any distortion or just tightness in there, we can do, again, very gentle releases that can help with the baby and help their ability to suck, because that's their way of getting food. A few more things that I've noticed, especially as of late, is what's something that's called torticollis. Torticollis is a tilting or twisting of the head. If there is that, then a baby's laying on that head and they're going to cause what's called plagiocephaly, or flattening of the head. And nowadays, because they've changed everything to the back to sleep, so babies are now recommended to sleep on their backs, everybody's on their backs, which is fine. However, it's creating another issue called flat head syndrome or plagiocephaly. And so the two go hand in hand. If a baby's head is turned one way, they'll be resting on that side a lot more, thus creating a flat spot in the back of their head. What chiropractic can do is we can help to increase the motion of the head, which is oftentimes the cause of the torticollis, as well as do some cranial work to work on moving those bones, because they're very pliable as young as infants, again, very gently to help the baby to be more comfortable. Oftentimes I will refer out to a cranial sacral therapist if it's a little more severe, and the combination of chiropractic and cranial sacral therapy are amazing. A couple of other things I notice are any sort of like motor developmental delays or abnormal motor challenges. So if a baby's starting to crawl and they don't have that proper cross crawl motion, maybe one hip is hiking up, or they're scooting on their bottom, that's a problem. It may look cute and it may seem like, oh, that's kind of fun, but neurologically it's the connection between the brain and the body is off, and the baby isn't able to do that proper cross crawl. So what we can do is look at the pelvis, look at the low back, look at the shoulders, the head, to see if there is a way that we can help that. Babies that are having hypotonia or a hard time standing because their muscle tension just isn't quite there, by adjusting them, kind of turning on the neurology kind of between the brain and the body, it helps to establish that connection. I've seen a few babies that have had a hard time with holding their head up or crawling and walking, be able to respond really well once they start getting adjusted. As we get older, ear infections are oftentimes a problem with children. I've got a local pediatrician who sends a lot of his ear infection patients to me because chiropractic is shown to help with ear infections and reduce the incidence of the fluid inside the ear. The first vertebrae, so you see one, which is right at the base of the skull, it's right behind the ear here. When that is distorted, if it's either pushed to one side or the motion just isn't proper up there, it can cause a lot of problems, one being ear infections as well. So obviously we'll adjust the baby. We can do some cranial work and work on the ears and kind of help to open up those eustachian tubes, and then do some cranial work as well to help everything to move and flow properly. We also do recommendations for certain supplements, ear oils, other types of recommendations for diet too that can help to decrease the incidence of ear infections. Moving on to older kids, anytime there's falls, any concussions, I am not a certified, I don't deal with the concussion specifically. I refer out to therapists that focus more on that if there is a brain injury. However, every time there is a brain injury, there is a cervical spine injury. And your cervical spine is here in your neck. And if the brain is bruised, there is an injury to the spine. So as a chiropractor, I'd like to look at anybody who's had any sort of fall. I mean, babies fall on their head, toddlers fall all the time. Checking the cervical spine is a good thing to do then too. Scoliosis is another thing that I see with children. Usually it's the prepubescent, usually girls, 10, 11, 12 years old, who once they hit puberty is when the spinal growth really starts, and that's when the curvature can expand or can worsen. So I've had a number of children in my practice that have come in with 10, 12, 14 degree curvatures that once we've started working with them, doing some adjustments, some stretching, those kinds of things, after 6 months they've had zero curve. So anybody who has the beginnings of scoliosis, even if the doctors say it's mild and there's not much they can do about it, a chiropractor can help for sure.
That's great.
Thank you.
Thank you, Dr. Adrian.
Yeah.
How often do you recommend parents bring their children to see?
Really depends. If a patient has a condition, one thing I didn't mention was constipation. That's another thing I see quite a bit. If I have a baby that's constipated, I want to see them every couple of days because I want to get them regular once we start to help everything flow better. So I'll see them a little more regularly. If a patient has plagiocephaly or has a significant issue, then I'll see them more regularly. But just for wellness care, if there's a handful of things going on, once every 2 or 3 weeks, once a month. Kids are growing rapidly, they're falling a lot, they've got a lot of different traumas, so it really depends on what the condition is.
There's 2 or 3 other disease conditions that our consumers have asked about.
Mm-hmm.
One is bedwetting.
Mm-hmm.
Is that something that you've seen in your practice, and is that something chiropractic can help with?
Yes, I have seen it in my practice. There's a couple different causes for bedwetting. Some may be dietary issues, so a lot of times a dairy intolerance is one of them, and that can affect the bladder. So I usually recommend dietary changes, first of all. But the nerves that go to the bladder are located basically right here in the sacrum. If you see here on my picture, the bladder is here. So if there is an issue with the tailbone, the lumbar spine, the nerves that exit those bones, if there is a concern with how the bones are moving, it can affect those nerves. And so that's how chiropractic can help, is by adjusting the sacrum, the lower part of the back, relieving the tension that's on those nerves there can help the bladder to function properly. There also could be a previous issue with constipation. I see a connection between bedwetting and constipation as well. So adjusting in this area, which is more of the lumbar spine here, and thoracolumbar spine, that area goes to the small and large intestines to help to address the constipation. So it's a very well-rounded thing, kind of finding the cause and addressing it with a couple different types of techniques.
Sure. What about sleep in children? Have you seen any patients that have complained about it and then benefited?
Absolutely. I had one little girl, I think she was 9 months at the time. She came in to see me. Her parents brought her in out of desperation. She's been sleeping 1 or 2 hours a night. And they had heard that, hey, I think chiropractic can help with this. So they brought her in, and within, I think, 3 visits, she was sleeping through the night. That first hour, that first night she slept 2 or 3 hours, and then it went to 6 hours, and then she's been doing that. She's now in 1st grade. I still see her about once a month or so. But yes. Basically, the premise is that when the body is calm, it's going to relax. And this works for children all the way up to the elderly. If your body and your nervous system is tense, and there's a lot of restriction or tension, if you will, on your nervous system, your body's not going to rest well. And sleep is your body's ability to heal. That's the time that we heal. That's the time that children grow. It's very, very important.